The most important challenges for mental health and vocational rehab is public awareness. Number one, it's simply to make people understand what families that have a mental illness problem that they're dealing with, or people that are been in the system that are trying to find a way to a life with dignity. The hardest thing is to get people to kind of look at them and get past the initial reaction of saying mental illness, we don't want to talk about it, or people that have problems, we don't want to have to deal with this is too hard, to kind of make that breakthrough to the point of saying, you know what, this is everybody. This is the family next door. These are the people down the street. These are my cousins. These are us. And if we can simply break that initial prejudice and that initial fear that people have and get the point of saying what's really going on here and how do we address it, we can accomplish fantastic things.
Working between VR and mental health nationally has been a tremendous challenge. But this is Oregon, and we do things differently here.
The way things are working in Oregon now with my counterpart in vocational rehabilitation is, I think, much improved.
I've known Bob Nickel, who's the administrator for the Office of Mental Health Services, for over a decade. He and I came into our respective positions about the same time. And so we came with a strong relationship, with a shared commitment to employment. And I think now at the central office level, we've been able to develop the partnership and the collaboration that has really existed in a number of places in Oregon at the local level.
We've been able to develop with our local vocational rehabilitation office some very practical yet innovative kinds of collaborations that range from being able to streamline the intake paperwork for vocational rehabilitation, as well as being able to educate the local VR staff about how our supported employment program works.
The barrier usually I have found between voc rehab and mental health is just a lack of understanding on a personal level. And once you really identify someone who's going to take the charge for mental health and for voc rehab, and they actually talk to each other, and it's that talking and having an experience of success that then begins to spread.
Mental health has had to change its way of doing business and be more like vocational rehabilitation in some ways, in that we're much more outcome-oriented now than we used to be. We used to just measure things by the number of people we served and how many times we saw them. Voc rehab always had to have successful placements. We're much more thinking along those lines in mental health now.
And I think in terms of what our state is evolving into is a much better system in terms of the cooperation between mental health and voc rehab, because the consciousness level about how pervasive mental illness is and how it does impact families and communities gives voc rehab that much more of an inspiration and desire to make sure that the programs work.
Supported employment, we have seen, can really help people who are still in the process of coming to terms with their illness, with the effects of their illness, with the loss personally of what that has meant for them in their lives as a result of having a psychiatric disability.
By providing supports which allowed them to work out in the community, we were really allowing them to make more progress. And it was only by doing that that you began to reduce hospitalization, reduce crisis intervention needs, really improve people's quality of life all the way around.
We will see people going to the hospital less. We will see people staying in housing longer. We will see people staying out of the correctional system. And we will see people using mental health resources in a very different way. I think that as people are more functional, more able to work in the community, we will start to see the erosion of some of the stigma.
Employers' response has been very positive. Employers are interested primarily in finding an employee who can do the job in their business that's going to help them be a successful business. So employers are interested in what we can bring to the table in addition to an employee who's going to be a good employee, reliable, knowledgeable, trustworthy, and competent at the job. We're also able to bring to an employer the added value of the support that the program is able to to offer.
It's a win-win situation. The system wins because we're using resources more appropriately. The consumer wins because they're getting their needs met. No one who has a psychiatric disability aspires to spend their life in a day treatment program. Nobody. They want the same things we want, and it's a date Saturday night, apartment, and a job to go to every day.
Support employment gets results, and a lot of what we do with the Oregon Health Plan, we try to look at to see what programs are actually succeeding, and support employment succeeds, and that's why I back it.
The reason we're partnering with Dartmouth and Johnson & Johnson is that they're working with us to develop what we call an evidence-based practice approach to supported employment, so that we're not shooting in the dark. We're following principles and following program guidelines that have already been shown to be effective with the same population.
I find as now the administrator of the agency, I am much more mindful of our resources. And I don't think that we can say to the public that we're using their money on anything other than things that we know will get us results. There are going to be instances where we continue to innovate and we only know down the road that this gets us results. But in the case of the Dartmouth Johnson & Johnson model, the evidence behind it is very strong, and certainly was something we needed to be doing.
To have a major corporation that is involved in healthcare, as well as a major university that is instrumental in doing much of the research and supported employment, it is very encouraging to us, and I know that the staff are actually energized and encouraged by the attention that we have been receiving through this project.
I want to see something get done. I want to see the results happen in people's homes. I want people on buses going through my communities who are focused on getting to work and happy about their jobs. So I welcome this kind of partnership, and we look for this partnership in every area that we possibly can.
The Dartmouth Johnson & Johnson model really frames recovery in a way that makes it accessible. It's not a miracle that's going to happen to you. It is something that you have control, you the consumer have control over. You see what's blocking success in your life. You see some ways to deal with those blocks. You get some help where you need it, but you don't get help where you don't need it. And I think that's one of the real keys to the recovery model.
Recovery is important to folks with psychiatric disabilities because they need the same hope. They need to have service providers who have the same expectations for them that we have for other individuals who experience chronic illness. And I think we have seen a real transition away from the diagnosis of a major mental illness sort of being a death sentence to the realization that this is a chronic illness, that there are things that we can do that people's functioning will improve and they can get on with their lives.
We have had many instances of people who have actually been able to move off of Social Security benefits and buy cars, put a down payment on a small home, who've really been able to resume, pick up their lives where they've left off, who've really been able to step back into the life trajectory that they have been on.
So recovery is really about getting your place back in a community in a meaningful way. And that makes a lot more sense to most people who are getting services than whether their symptom scales go up or down.
Recovery in this model is based more on you will live the most productive life and effective life that you can live, and if you take a step backward, you can still get there. You just need some more help, or you need to define a new skill that you need. It's a dynamic, ongoing process. It's a journey, not a final goal.